I think that's a very interesting question because now 25 years after the introduction of the anti-TNF antibody infliximab, we still do not have a biomarker that really predicts the disease course or also the response to advanced therapies. And why is that the case? I think because we still call both disease entities Crohn's disease and ulcerative colitis, but I think there are more heterogeneous subtypes that we have not really identified, I would say on a molecular level. For instance, perianal fistulizing Crohn's disease or ileal Crohn's disease is totally different from colonic Crohn's disease. So I think we first have to identify these heterogeneous subgroups, probably on a molecular level, I would say, and then we can perhaps identify a biomarker for this subgroup within Crohn's disease and ulcerative colitis. So I think with the new technologies that we have now on a scientific level, like multi-omics approaches, I hope that we can really advance our research in that way, because we really need a predictive biomarker for the rational use and application of our advanced therapies. And there are ongoing research collaborations, I think, between academics and industries. And I think this is something that we have to do to put all stakeholders together to finally really identify biomarkers for predicting disease course and also for predicting response to therapies. I'm hopefully looking into the future. We looked at very high expectations towards the results of the profile studies because this was the way that the study had to be done. They found a biomarker, a potential biomarker, they developed it into a diagnostic test that can really be utilized everywhere. They validated it in multiple cohorts, and at the end they did an interventional study. So this is really a blueprint how you can take a biomarker from finding one to hopefully implementing it in the clinics. So the results were really disappointing, one has to say. This was the last step. So there again, a biomarker that finally failed due to validation in interventional trials. So I think this is something where there's still a need for, an unmet need for ongoing research. So I think in this regard, I think we have to find, again, on a molecular level, and I would say on a molecular level that should really look at the tissue, because the tissue is the site of inflammation in inflammatory bowel diseases. What is the molecular composition of the disease in every individual patient, and then see in how far does this really change perhaps in the course of disease, also under therapeutic pressure. So I think then we will learn more, let's say, of the molecular drivers of disease and also resistance mechanisms to therapies. I think this is very important now, not only who responds to a therapy, but why does a patient not respond to a therapy, and hopefully we can then identify the molecular target that is then best suited for this patient for the subsequent therapy. So I think there are still a lot of unmet needs in the therapeutic area of inflammatory bowel diseases, a lot of ongoing research activities, and hopefully this will really lead us to really improvements in taking care of our patients.